It looks like Queensland finally has a sensible Chief Health Officer. Let's have a look. Hello everyone, Florian and Heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee because we've got what I would say is almost an early Christmas present. This is from news.com.au, written by Alex Druce. Spreading the virus is necessary, and this is from our Chief Health Officer here in Queensland. Somehow I'm kind of happy Young has been promoted up. Isn't that the old Dilbert saying? You promote up the incompetence? Anyway, let's have a look. Queensland COVID cases nearly doubled. Chief Health Officer says that spreading the virus is necessary. Queensland's Chief Health Officer says residents have two choices as the Omicron variant embeds itself in the community. Queensland has reported a dramatic surge in daily COVID numbers, with new infections nearly doubling to a record 369 on Thursday. But far from panicking over the rise, Chief Health Officer Dr. John Gerrard says the spread is essential and necessary in order for the pandemic to evolve into an endemic phase. He says it's essential and necessary in order for the pandemic to evolve into an endemic phase. Isn't that fantastic to hear? We will all have to have immunity. You will all have to develop immunity, and there are two ways you can do that, by being vaccinated or getting infected. Now, the only issue is, will the government recognize overcoming the illness via infection as the equivalent of vaccination with regards to papers, please? That's a level of nuance and sophistication that I think will take some time for the government to catch up on, but at least this is being mentioned at a high level. But the early information we're getting is it seems to be a little milder, and certainly the vaccine is protective. We're not going to stop it. We're going to just try and slow it down a little bit to enable people to get those third doses. Queensland's new numbers are a significant rise on the 186 cases recorded on Wednesday and 86 on Tuesday, as the Omicron variant embeds itself in the community. Critically, just one person is in hospital specifically for COVID treatment. Just one. One. Hang on. The total number of infected people in hospital has risen from 79 to 93, and 163 people with COVID are receiving care at home. So I'm assuming that one person is in ICU. The number of active cases in the state is now at 807, up from 447 on Wednesday, with 123 confirmed Omicron cases. However, Dr. Gerrard said that Omicron figure was likely higher because of a lag in the testing system. Authorities expect case numbers could reach the thousands by January if daily cases double every 48 hours as expected. Queensland's admission that it is necessary for the virus to spread contrasts starkly to the messaging in months prior to the reopening of borders. Of course, the state's early border stance and focus on containment came as vaccination rates lagged, with the threat of infections from New South Wales and Victoria presenting potentially deadlier consequences. So far, authorities are confident Queensland's vaccination drive and border pass regime has prevented a more significant jump in hospitalisations. Premier Anastasia Palaszczuk said she remained concerned over vaccination rates on the Gold Coast, which is one of the most exposed communities to people arriving from New South Wales and Victoria. They're coming here to the Gold Coast, and the Gold Coast is exposed because people are not vaccinated, Ms. Palaszczuk said. Thursday's caseload update also comes as new mask-wearing rules for certain venues come into place. Face masks became mandatory in cinemas and theatres, and for hospital staff from 5 a.m. on Thursday morning. Masks were already mandatory in supermarkets, shops, on public transport, and in ride shares. Dr. Gerrard on Wednesday said it was inevitable that public health units will wind down their investigation efforts as the virus spreads further. So, there we have it, everyone. Let's have a talk about, well, this somewhat change in stance. This is fantastic news. This is what we want to start hearing from chief health officers, from politicians, from members of the bureaucracy. The realization that we've done all that we can. People have gotten vaccinated, so people are going to catch this illness. There has to become a point where we realize that we just have to, well, adapt to this illness, and the illness will adapt to us, and life will go on like normal. I think there'll be some people disappointed that this isn't going to be the collapse of society and the end of the world and the Great Reset, the propaganda from the World Economic Forum for their socialist and environmentalist push is going to fall on flat feet too and not achieve much. So hopefully this next year will be a turning point. What do you reckon, everyone? But still, I want you to check out this video I did on my Real Politic channel about COVID-19 affecting your sperm count. So lads, there'll be a 3-month delay in your ability to procreate afterwards. Or not delay, it's just going to be a bit harder. So probably more practice and more red meat. Take care, and I'll see you all next time. Bye for now.